Welcome to the Public Health Millennial Career Stories Podcast, episode number 108. Be sure to follow me on Instagram at the PH Millennial. My name is Amari Richards. Thank you so much for joining me for another episode. Be sure to subscribe if you have not as yet. Hit like if you're on YouTube. Greatly appreciate it. Today's episode is just going to be me. An overview of today's episode, I'm going to go over the live event podcast network that I have, job searching. So 3 strategies for job searching. And then I'll talk a little bit about the giveaway that I'm hosting currently. This is the Public Health Millennial Career Stories Podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Yes, I'll be having a live event with Jasmine Leonard on Tuesday, the 21st of June at 6 p.m. Eastern Standard Time. Be sure to join us then to discuss her Bloomberg Fellowship, the financials of a doctor of public health, and all that jazz. If you have not as yet, be sure to follow Jasmine on Instagram at Health Equity Jazz. Congratulations to Jasmine for getting into the Bloomberg Fellowship at Johns Hopkins University Bloomberg School of Public Health. That's pretty awesome. And there's a link in the description for the YouTube Live. So a little bit more about my Public Health Millennial Network, which is currently just a network of podcasters. I have 3 podcasters that podcast on the network, and I'll just give an overview of a lot of the things that they have been recently doing. So Tea with Tanya, she is a millennial sharing public health stories, self-love, and wellness tips. And she has new episodes coming out soon, season 3. So be sure to follow her or subscribe to her, I should say, on all podcast platforms so you don't miss that. That's Tea with Tanya. And one thing that I wanted to share, like a tidbit from one of the episodes that I enjoyed, which was season 2, episode 8. So check that out, was just her points of like showing up for yourself and ensuring you're putting yourself first and you are prioritizing yourself and your well-being, because it's so important, especially in this work, that we are prioritizing ourselves and knowing that we're doing this for ourselves, because a lot of times there's a lot of external forces that are pulling at us. And I think it's important that we realize that we need to focus on self before we can give fully to the world and to others around us. So give thanks to those of us that are prioritizing us, and I hope that a lot of you all are able to like prioritize and redefine like what that means to you. And going right into that is the Redefining Rest for Public Health Professionals podcast by Marissa McCool. She interviewed me in episode 100. If you have not checked that episode out, be sure to check it out. And her latest episodes, there probably is going to be one that is more recent than the ones that I stayed here, but her latest episodes are why you aren't taking paid time off, which I think is important for all of us, especially in this time, to listen to that episode. But I'll let you go check that out. So be sure to subscribe to her. That's Redefining Rest for Public Health Professionals on all podcast platforms. And the episode that I just wanted to touch a little bit on was her episode on life is 50-50. And she had a quote in there where she said, "Resisting reality doesn't change the situation. It actually makes it harder to go away." And that sentence just really hit me, and it made me just reflect and think about how important it is for us to not only look at like what good things happen to us in life and saying, okay, this is good, let's take that, but what are the bad things that are happening in life and how can we embrace that and learn from that and move on and grow from that. And I think that's important. And Marissa talks a lot about rest and what that means for public health professionals. So be sure to check that podcast out. And last but not least is the Healthcare Hustle podcast hosted by Winston Wellington Wright, really focused on equity and healthcare and everything in between. Be sure to check that out. And the episode that I wanted to highlight here was the episode that he had with April Wickens Jolly, and I hope I said her name correctly, the VP of Health Equity and Culture at Planned Parenthood. And the one thing that I took away from this podcast that I wanted to share here was when she said something around the lines of asking the community and the people impacted what they need and then not giving them that bakes in inequities. It bakes it in. And that is facts, because you're telling people to come to the table, to share their opinion, to take their time that they're probably not getting paid for. You're probably getting paid to do whatever you are doing around these different policies or systems change efforts. And the community is not allowed to do that. But then you tell them to come and use the resources to do this, and you give them nothing back. That is baked in inequities. And I really like the fact that you went on to talk about how we need to continue to support the people that are doing the work and the ones on the ground and the ones that know the community community, and really setting up pathways as well as processes and data to ensure that we have feedback, both qualitative and quantitative, to see what is happening, how can we better approach and work with community to resolve the issues that they know the solutions for. And I think like that kind of mindset was huge. So check that podcast out. That's the Healthcare Hustle podcast with Winston Welting, right? And before I get to the 3 strategies that I said that I would share about searching for a job right now, especially if you just recently graduated and you are struggling to get a job, I would like to say that I'm open to speaking engagements. So if you'd like me to speak at your school, at your association, or any other organization, and around whatever issue it might be or whatever topic it might be, I'm very versed in a lot of professional development using social media, LinkedIn, community development, understanding, community engagement, a lot of things on the web. And just, I have a lot of different perspectives that I think are unique. So if you like me to come and speak at one of your organizations, please feel free to reach out to me. Go to the phmillennial.com and you can see there's a tab for speaking and just fill out the information and I will get back in touch with you, especially if your school is starting up and doing some professional development and looking for speakers, or if you work in career services, please feel free to reach out to me. I'd love to converse more around that. And for you all that have been waiting, here are the 3 strategies I want to share with you all if you have been struggling to get a job after you graduated and you're just having a hard time. I know a lot of people, when I was in my MPH program, had that difficulty. And I just want to share some resources and simple strategies that I think you can use. And if you stick around to the end, I'll give you a bonus one. Here's that. So number 1, write an email to everyone you worked with. So that could be from CEOs to managers to the directors to professors and even peers that you've worked with, and send them your resume. Tell them a little bit about the context of your situation and what type of jobs you're trying to get into, and tailor to what you think they would be best suited to move forward with. So if your professor was in health economics, if you want to get more health economic type jobs, reach out to that professor and share that type of context. But if you are saying that you just want to reach out to them because you think they have a broad network, then that's fine. And that's a different email that you have to tailor. But tailor to the context of the job that you aspire to get into, and try to make the connection in your mind to which people have the kind of skill sets and may have the connections that help you get there. Okay, so you can do this either do this by a group or personally. And there's a time trade-off that is inherent in this. If you do it as a group, you're going to be able to do it a lot quicker, a lot less stressful, but you're not going to be able to tailor everything to the individual level, to what every specific person has done for you and helped you, and how you would appreciate the help and support as you take on this next step of your career. So this can sound like you starting saying that it was a pleasure to work with them and to meet them, and you really appreciated their mentorship and the experiences. If they were a funny story that happened between, or something that you learned while you were working or aligned with them, definitely share it. You never know who people know. And I think that's really important, especially we think a lot about LinkedIn, but there's a whole bunch of public health professionals and professionals in general that just are not on LinkedIn or are not active on LinkedIn. So while LinkedIn is a great resource, there are those other connections that you can get from just doing these kind of warm, hey, can you help me? And in the email, I'll ask, you should ask something along the lines if they know of other opportunities, or if they know of people that may have other opportunities or more aligned with the things that you are trying to do, and may be able to connect you to other opportunities or other people that may be able to help you. So you should really think about this. Like if you had a health economics professor, you're probably going to ask a health economics professor to help you get those health economics jobs. But if that's not the case, then try to ask them for broad recommendations of people that they can connect you with. They are bound to know someone that you are aligned with, and you can benefit from that connection. I would say that it's always best to say, even in the email, you send your resume, but let them know that you are willing to tailor a resume to a different person that may be helpful and share in a different context of your experiences, because I think that is also important, letting them upfront know that, hey, if there's an opportunity that might be a little different from what I've portrayed myself to be experienced on in my resume, let me know so I can tailor it to different words and different experiences that I've had that would be more beneficial for me in making that for next connection. I think that's something that you can really think about. And lastly, for this, I would say, when you're sharing these emails, Don't share the ideal job title. Share the ideal job roles and experiences that you would like to get more familiar with. So, for example, if you're trying to get into a director of maternal and child health role, share being able to work collaboratively around diverse stakeholders. Share that you have evaluation skills that are informative to drive programs forward. Do different things like that that are more helpful in a broader context than saying you want the specific job title, because sometimes we don't know the types of job titles, our roles, and what our future careers would be. So just don't box yourself in that way. So number 2 is reaching out to the HR managers. So I know this is best done on LinkedIn because most of the time you cannot find this on Indeed or other sites, but you can always go to the website and see if there's a hiring manager and reach out to them. But if there's not, I would tend to go to LinkedIn because they typically have the hiring managers on the page. And therefore, you can click on their page, you can reach out to them, you can have a conversation with them, have a virtual coffee, and share more about what you would like and ask them more about the role and get familiar with them, because those kind of connections might just get you the job because you're actually reaching out and sharing that you want this. And a lot of them have the time to do this type of connection with people. So don't give up on the simple way of just reaching out to someone that you see on LinkedIn as a hiring manager, because even if they don't connect you with that specific role, they are bound to know someone else that's hiring for a similar role, or they might know that your resume and your skill sets are more suited for a different role in the company. So you never know. Just reach out to those hiring managers. And I think LinkedIn is probably the best platform to do this on right now. The third one that I want to share, and this kind of goes into the number 1, is reach out to the alumni network. Reach out to the alumni network. And one thing I love about this too is like LinkedIn, again, sorry, I should get sponsored by LinkedIn by this, like at this point in my life. But anyway, LinkedIn is awesome because you can go to different organizations that you want to work to. And there's a thing that says alumni, how many alumni work there? And you can click on that and you can see the different alumni that work at the program. And let's say you're in public health, okay, what kind of degree are they going to have? They're going to have an MPH, they're going to have an MSPH, they're going to have a DRPH. I would stay away from the PhD because that's broad, but type that in, and when you search in to see what kind of people pop up, to see, okay, what kind of role are they in? Can I reach out to them and make that connection? Are they going to be helpful to me? And people love people from their school. They love relating to people in their school, especially in the US. So do not sleep on this. Alumni have a lot of connections and they can be very helpful, especially alumni that have done the work and are in good positions to really help you navigate the field from where you want to go. So look at LinkedIn, check out those organizations, reach out to alumni. And the last and obvious bonus tip here is just a traditional method of having job alerts on and applying to each job with a tailored resume. So job alerts like Google job alerts, LinkedIn alerts, Indeed alert, different places where you can have different job titles saved and they're able to find it, send it to your inbox. That is how I was able to get my community health fellowship after my master's in public health program. It was an opportunity in Alaska. Do you think I was thinking about going to Alaska? No, I was not. But it fell into my inbox because I had on the search title Public Health Fellowships for the entire USA in Google Job Alerts, and it popped into my inbox. So just put on these job alerts. You don't even have to look at them all the time. Just delete them sometimes, but you never know what kind of job pops up there, and you never know what kind of opportunities you will get. So make sure you're tailoring those resumes. There are many services and people out there that can help you get those jobs. So be sure that you're putting your best foot out there, making sure your resume is up to date, succinct, and tells all the great experiences and skills that you've had and you've contributed to different organizations and how you can be helpful to this new organization. And what most of you have been waiting for is the giveaway alert. So you all might have seen on my Instagram at the PH Millennial that I'm going to do the giveaway of 2 health equity t-shirts as well as a mug on my website. You can check on my website at thephmillennial.com/shop to see all the merch there. But this giveaway is going to go until Tuesday, 21st of June at 11:59 Eastern. The ways to enter are Instagram. You can like the post. So just go and like it. I'll link it in the description and tag 3 friends, which is 1 entry. You have unlimited entries, so do it as many times as you like. The optional entries are if you review this podcast. Wow. So review the podcast, send me a 5-star review, send a screenshot, and that's 3 entries. You can screenshot and send it to, you can either DM me at the PH Millennial. I can send it to my email, thephmillennial@gmail.com. If you subscribe to me on YouTube, that's another 3 entries. Please send a screenshot of that to me as well. And if you share this post in your story and tag me, you can be private. You also get 3 entries of this as well. And you get 1 entry a day. I didn't even realize I was doing that, but hell yeah. And if you listen for this long, I'm going to give you all a free 10 entries. So if you just go and DM me on Instagram at the PH Millennial, DM me giveaway, you will be entered for 10 entries, and that will be added to all the other entries. So I hope that you all are excited about that. Thank you all for listening. Be sure to share this so people can get some 10 entries as well. Look forward to announcing the winner soon, and I hope that you all are doing well. And I recently did a poll on my Instagram, and I think it was like 78% of people either said that they themselves had COVID or someone they knew had COVID. So I hope that all of you are doing well and are really being safe as best as you can as we approach the new era of COVID. And I hope that you all are taking the precautions, especially to keep those with pre-existing conditions and that are more at risk for dying of COVID, because we know that is the huge risk now, safe. So do that. Thinking about all of you all. Appreciate you all listening, and be sure to subscribe to the Discord. As I mentioned a little bit earlier in the episode, I think it's very important to have wellness and to have you as your best self so that you can serve the community and really shift the systems and do the public health work that we all want to do. So be sure to join the Discord, and it's called Community Health and Wellness at the PH. You can go to thephmillennial.com/join and join there. It's just a community where I'm not only trying to build out like professional development for public health professionals, but a community where you can really have that wellness component and really better yourself and just live the healthiest life with community and public health and community health focused people. So be sure to join that at thephmillennial.com/join. Subscribe, like, follow me. Appreciate you all. Peace.